Pets are known for offering unconditional love, which has been a godsend for many pet parents experiencing isolation this past year. Now, a new study is taking a closer look at how therapy dogs are making a big difference, especially for older Americans who are experiencing loneliness. Here to tell us more about the power of the human-animal bond and the role man's best friend can play easing loneliness is veterinarian Dr. Angela Hughes, joined by Dr. Nancy G., who's director of the Center for Human-Animal Interaction at Virginia Commonwealth University. Welcome to the show.
Thank you for having us.
Angela, let's start with you. How has the pandemic shed light on this problem of loneliness?
So even prior to the pandemic, loneliness was considered at epidemic levels, and experts have equated it to roughly smoking 15 cigarettes a day in terms of its impact on our health, which is quite significant. But the pandemic itself has certainly exacerbated the levels of loneliness, with 6 in 10 adults now reporting being lonely since the start of the pandemic. And older adults in particular are impacted by the fact that they had to, be very careful to not get COVID because of the increased rates of infection and mortality in that population.
Yeah, and Nancy, we just heard, older Americans are so vulnerable to that loneliness. What is the health impact when they experience that?
Yeah, it's a pretty big impact. So what we see is that for individuals who are 60 years or older, 43% of them are reporting loneliness before the pandemic. Then the pandemic hits and it's even more pronounced. And even more concerning are older adults who are hospitalized for some reason. Those individuals are displaced from their social networks. There's a variety of impacts in terms of an impact on both mental and physical health. We see increases in depression and increased risk for cardiovascular disease. We also see that loneliness reduces their willingness or ability to participate in their own rehabilitation process. So it's very likely that loneliness probably negatively impacts their own recovery from being admitted to the hospital.
Right, and we definitely want to avoid it or get help if someone's experiencing that. Now, Angela, owning a pet comes with a lot of responsibilities, but there are other ways people can spend time with animals, and that's going to help alleviate some of the loneliness.
Yeah, so many times pets can provide an outlet to us when we can't have that interaction with people that we're so used to. In fact, evidence is mounting that animal therapy programs like the Dogs on Call team at VCU Health that Nancy leads can provide really positive impact on people's mental and sometimes even physical health. 5 minutes with a therapy dog can help our very stressed healthcare workers have a lower level of cortisol, which is critical. That's a stress hormone. So things like that are really amazing. And so if you can't have a pet in your own home, you can still look at avenues for animal-assisted intervention or animal therapies to get some of these benefits yourself.
Oh yeah, that is good to know for sure. Now, Nancy, tell us more about this new study and how it'll explore the effectiveness of interacting with a therapy dog to improve loneliness.
So loneliness is our key outcome measure, but we're also going to look at a number of other things like depression, anxiety. A variety of variables are going to be included in the study, but we're going to look at older adults who have been hospitalized for some other reason. And then what we're going to do is give them the opportunity to interact with our Dogs on Call therapy dogs. And they can do that for 3 days in a row during their hospital stay. And we're going to measure them before and after each visit. Then we're going to measure them 1 month and 6 months later. So in short, we're conducting a randomized clinical trial with a longitudinal follow-up. This is really the highest level of scientific evidence we can bring to bear on the topic. This is going to give us insight into sort of the trajectory of change. Does this intervention with these therapy dogs alter their health outcomes?
All right, and as Nancy just said, this will be looking at the interaction between humans and animals. Angela, what are you hoping comes out of this study once we get the results?
So we're really hoping to get a better understanding of the circumstances under which pets may help improve human health and provide evidence-based recommendations to professionals who are working with people who are impacted by social isolation and loneliness to understand when they might be able to recommend a pet either in a home or a pet therapy program such as the Dogs on Call team. So if folks are interested, they can go to waltham.com waltham.com, to learn more about this study and related studies that we've supported.
All right, Doctors Angela and Nancy, thanks so much for your insight about pet therapy this morning. And you can learn more about the Center for Human-Animal Interaction by visiting chai.vcu.edu.